So in the eyes, it can cause retinopathy. What are the diagnostic tests that you would require if you have a high blood pressure? So blood pressure is of two types here. One is called essential or primary hypertension, which especially occurs in an elderly person, generally about 35 or 40 years of age. However, we are seeing nowadays essential hypertension in younger age group also. And the second is what is called secondary hypertension, where the hypertension has got some reason, for example, a kidney damage, a chronic renal failure, or the artery of the kidney getting narrowed down, called renal artery stenosis, or a problem in the adrenal glands causing increase in steroid production like Cushing's disease, or hypothyroidism or hyperthyroidism. All these other type of illnesses can cause high blood pressure as one of its manifestation, and in that case it is called secondary hypertension. Most cases, however, almost more than 90% cases fits into what we know as primary or essential hypertension. In this, no cause can be found for the hypertension, but the diagnostic test which is required is a lipid profile, a blood sugar count, a renal profile, and a sonography abdomen for assessing the kidney size, an ECG to assess whether there is myocardial infarction, a 2D echocardiography to assess whether there is LV hypertrophy, left ventricular hypertrophy, a retinal examination to rule out retinopathy, etc., and a stress test which shows whether there is myocardial infarction or not. How do we treat hypertension? So there are basically two approaches that we have to take while treating hypertension. One is the lifestyle modification and the second is drug therapy. In lifestyle modification, as we discussed before, we cannot do much about the unmodifiable factors, that is the age and hereditary tendency, but the modifiable factors are as follows. That is, you advise the patient to reduce weight, decrease salt intake, that is no extra salt in diet, decrease alcohol consumption, stop smoking, do daily exercise so that the circulation improves and that helps in controlling the blood pressure, increase the vegetable and fruits in your diet, and decrease total calorie and fat intake in your diet. Also, the polyunsaturated fats in the diet should be increased, as well as the monounsaturated fats. The fish oil consumption is helpful because it has omega 3, 6 and 9 fatty acids. Total fats in the diet should be reduced, and many also advocate regular use of aspirin, which thins the blood and prevents myocardial ischemia and infarction and strokes, and the use of statins, which helps in reducing cholesterol. And most important, of course, is the control if the patient has diabetes, to have a proper blood sugar control. The drug therapy is what your doctor is going to decide for you. There are essentially about 7 or 8 groups of drugs, and any hypertension specialist that you are going to visit is going to use one of these drugs. So these drugs, the scope of discussion is beyond this session. However, I'll just enumerate that there are diuretics, there are what is called beta blockers, which helps in reducing the pulse rate and the blood pressure. There is third group which is called calcium channel blockers. Then there is ACE inhibitors. The action is on the kidney in the renin-angiotensin mechanism that we spoke about. There is angiotensin 2 receptor blocker, alpha-1 adrenergic blocker, central adrenergic blocker, and natriuretic peptides. So these are the group of drugs, and one or more of these drugs would be required to control your blood pressure depending upon what your baseline